Okay, ladies and gentlemen, welcome to our healthcare awareness series for the 26th of June, 2026. I want to welcome our guest speaker today in the person of Dr. Chimezie Ezenabike, who is one of the employees or the coordinator of National Health Insurance Agency, Imo State. Dr. Chimezie, you're welcome to the CSAAE Healthcare Awareness Series. Please,
Thank you very much for having me.
Yeah. Tell us a little bit about yourself and your work.
Okay. My name is Chimezie Ezenabike. Okay. I am the current National Health Insurance Authority Imo State Coordinator. And we have done a lot in that area of health insurance. But by training, I'm a medical laboratory scientist. And I have my master's of medical microbiology and parasitology. And I also have a master's of public health and a PhD. So I think that will suffice for my personal qualification. Then touching National Health Insurance Authority, we have been able to establish.
Okay, Dr. Chimezie, thank you so much. I know we'll have opportunity for you to talk about National Health Insurance Authority. People confuse it with NHIS. People call it NHIS. Other people call it NHIA. So which one is the proper name for your agency at this time?
Okay, thank you. It used to be NHIS. Actually, the name before was National Health Insurance Scheme. But the NHIA Act of 2022 changed it to National Health Insurance Authority and then gave us more responsibilities. By this, the new name and new responsibility mandates that health insurance is going to be mandatory for every Nigerian and every legal resident of the nation. When it was a scheme, most of the things were voluntary. But now that it's an authority, we are given three major responsibilities: to promote, to regulate, and to harness all the private sector arrangements to promote, regulate, and integrate all the efforts in the health insurance ecosystem to ensure that everything is streamlined towards universal health coverage.
Thank you. Thank you so much, Dr. Chimezie. But before we ask you more questions, I would like our colleague here, Doris, to please introduce herself very briefly to our viewers from across the world.
Okay, thank you very much. My name is Kanu Dorothy or Doris, and I'm a geriatric caregiver, which means I care for the elderly individuals, and I'm also the program officer under the CSAAE Healthcare Access Center, C-Health. Thank you very much.
Thank you, Doris. You're welcome to our health awareness for this 26th of June. 2026. So back to you again, Dr. Chimeze. Now tell us a little bit about the work of NHIA. You said you were created to promote, to regulate, and probably also to provide health insurance or something like that. So people know you as that organization that provides the NHIA health insurance, and that's about what we know about you. And but I think it's like you have more roles that we don't hear about. Can you tell us very briefly the extent of your role and the authority given to you by Congress, by the National Assembly when it comes to health insurance in Nigeria?
Okay, thank you very much. So our role involves three major areas. The first one is to promote, to integrate, and to regulate health insurance in the entire country. Because there are lots of actors in the health insurance area. We have lots of people that play different roles. And there are lots of privately owned and even, yes, some publicly owned outfits that are desirous to provide health insurance or healthcare benefits to those people that are subscribing with them. You must have heard of some of the health maintenance organizations, that's the HMOs. And we also advocated to, because when we are experiencing some challenges with getting the states to buy in, we now advocated that let every state roll out a health insurance program so that it will be easy for them to get the states, that's their populace, to buy into the program with ease. So it is now done in such a way that all the states in Nigeria now have a health insurance agency. But all these players are regulated by the National Health Insurance Authority. At some point, we called it health insurance under one roof. So no matter what you are doing in whatever sector that you're doing it, we are still the one that will determine the roles and ensure that there are no overlaps in the responsibilities of these actors. That also helped us in the visibility that we desired at the point. And then it also helped us to get across to the areas, some of the very rural and sub-rural areas that we felt that the state actors can easily get across to, but it may not be easy for the national. Then the HMOs, on the other hand, are expected to design programs, design healthcare benefits, and sell them to all the people that that may not have access to the national program.
Dr. Chimeze, thank you so much. I think we want to take it step by step. So the public can understand the roles, the principal roles of NHIA. Number one, you provide health insurance to Nigeria as a national health insurance authority. Am I correct about this?
We regulate health insurance, but we also play some major roles in the implementation, just like you said.
Okay, so when people say they are buying NHIA health insurance, what does that mean? Can you explain to us the dynamic so we understand? Because what the average Nigerian out there thinks is that is that you provide health insurance as an
Okay, we do provide we do provide health insurance, but we also regulate other actors that provide
I'm
health
coming to
insurance.
that. I just want to be sure that you provide health insurance, directly
Yeah, we
to
do.
the
We
Nigerian.
do provide health insurance directly to the populace, exactly.
Okay, thank you so much. Then
Yeah.
a second rule is that you regulate other health insurance companies in the country, including state-owned health insurance, private sector health insurance, right? Is that what you're saying? That also
Exactly. We regulate all the actors. There are different stakeholders that are playing different roles. Like there are the healthcare facilities, they are the ones that we patronize in this, they provide the benefits and we pay them. And then there are the HMOs. Some of them also have some programs that they sell to different organizations and communities. And then there are also the CSOs. There are some faith-based organizations that all these play their different roles, but right under our close watch. And we have also gone ahead.
So if I get you right, because I know that under NHIA, there are HMOs that are affiliated with NHIA. But there are also HMOs that are not affiliated with you, that do not provide. For example, Police HMO is affiliated with NHIA. So if somebody buys insurance from NHIA, it could be that the HMO servicing him is police. But we have other health insurance like DOT, for example. I'm not sure that DOT is affiliated with NHIA. They are just private sector health insurance out there. And I think there's another one, Salutary or Salutaris. So I wanted to know the extent of your regulation or the extent of your regulatory powers. Do you also regulate these other private agencies that are not affiliated with NHIA somehow, somewhere?
Thank you very much for your question. There is no HMO that is playing in the Nigerian health insurance or managed care ecosystem that is not accredited by NHIA. We hand out the accreditation to you. And just like I was about to say, we also went ahead and designed the mandatory basic minimum package of healthcare. That's what I mean by this, is that there is the base below which no player can provide healthcare benefits below that minimum package of health. I don't know whether you understand what I mean. Healthcare benefits actually are just like a list of package or a list of healthcare conditions that are available for a subscriber. So we have also designed a basic minimum package below which none of these actors can sell.
Okay, thank you so much.
So now the ones that you mentioned, the ones that you mentioned that you think that are functioning in the private sector are also being closely regulated by NHIA, because just like we have an exercise that we call reconciliation exercise, where if there are payment issues between healthcare facilities and the HMOs, they bring it to this place so that we can see who owes what to who. Even in the private setting, they bring in their claims or those areas of conflict.
Okay.
And we look at.
So that is where I'm interested in, and I want us to talk a little bit about it. My understanding and the understanding of many Nigerians is that NHIA is a government supported owned health insurance, but it works with various HMOs. I mean, this is not new. I mean, if you go to UK, there's a social insurance, but there are also private sector insurance. If you come to America here, we have the Medicaid that is owned by the government. But we also have Blue Cross, Blue Shade, and different other kinds of health insurance that citizens can buy into. So I would imagine that NHIA would be like the social insurance in UK or the Medicaid in the US or something like that, owned directly by the government and designed in such a way to support the citizens. But citizens also have a right to buy from private sectors. So when it comes to NHIA, I would imagine that the government of Nigeria is partnering with some HMOs in Nigeria to provide health insurance under its own NHIA. We are not talking about delivering health insurance. I'm not, that's what I understand. I may be wrong. You can correct me after I've finished analyzing how I understand your roles to be. But there are also other HMOs. For example, we have a health insurance marketplace we are building, and we have over 83 HMOs not affiliated to NHIA, but they are just health insurance providers in the country. Some of them are just in only in one state. Some of them are just, like you said, owned by, the Catholic Church. Some of them are owned by other people. So, but they are not it's affiliated with NHIA, like maybe Police HMO is affiliated with NHIA, but there are others that are not affiliated with NHIA. And if I hear you correctly, you are saying all those 83 health insurance, private-owned health insurance firms, providers, they are regulated by you, they are monitored by you, they are held accountable by your authority or agency. Am I correct?
Yes, you are. The last part of your assertion is very, very correct. First of all, for you to float out you cannot float out a bank without accreditation from the central bank.
Exactly.
You cannot float out a HMO without accreditation from NHIA.
Okay.
So, and why we also enter that area is because of the fact that we wouldn't want a situation where an organization floats out a HMO and promise heaven and deliver the other extreme. So it is very, very important that we regulate all the way to that extreme and ensure that that basic minimum package of healthcare is not people are not being given another thing for the things that you promised. So despite the fact that they may not be serving in the public sector.
Very good.
But they are still rendering the quality and the basic above the basic minimum package of healthcare that's related.
Yes, minimum, you have specified that. But how about the actual service provision? When these people say they are going to provide this service to you, a citizen, and a citizen pays for it, and when they do not provide these services or do not provide them in the way that your office has demanded, has regulated, has stipulated, do you also weigh into these concerns? Can citizens bring these concerns to you and say, hey, there's this HMO company in Owerri that I signed up health insurance with, and they promised that if I get sick, they would, they take care of my malaria and whatever. And I went and I couldn't get anything. I called them, they're not answering and all that stuff. Can citizens bring this concern to you? And when they bring this concern to you, what should the citizen expect?
Okay, thank you very much. So just like you said, the subscribers to any of these HMOs are at liberty to lodge complaints against them should there be any breach. In fact, we just like I said, a reconciliation process exercise is afoot, and most of the times the concerns, especially in the financial area, of it. It may not even be just the subscribers alone. The hospitals, sometimes they feel that, okay, we are dealing with the hospitals, and what we normally demand is for the MOU that must have been signed between these HMOs, the hospitals, or the company that saddle them with these responsibilities. So when they bring it, we have a legal team that look at these things, ensure adherence to what we stipulated as the basic minimum package, then ensure if there is and then investigate whether there is a breach of issues between what they promised and what they are delivering. And then they're held accountable for it. We have had to de-accredit lots of HMOs
that are not affiliated with NHIA, that are not public service, private HMO companies. So people bring those.
Yes. As long as you're a HMO functioning in Nigeria, it's accredited by NHIA.
Okay. It's very interesting to know, because sometimes the public don't know, and people just get upset, get angry, abandon it, walk away, and that's because that's the topic we are treating today. Whether health insurance works in Nigeria. And so some people have this impression that it doesn't work in Nigeria. And that's why we have brought you in here. And it's interesting. It's very inspiring what you're saying. And I know that our listeners from across the world and viewers from across the world are hearing you, and they will be taking action, because sometimes people don't want to sign up for health insurance because they believe that it doesn't work. There's nobody holding the companies accountable. They're going to just take their money, they won't pay them and everything. So it's interesting to hear. Sometimes people go to the hospitals, and the hospitals will tell them that there's no medication. Maybe the doctor will see you, or even when there are some tests that you need to do, the hospitals will tell you that, they don't have that test in their hospital, meaning that you have to go elsewhere and pay money to obtain a test that that is covered in your health insurance package, simply because the hospital you're going to is saying, we don't do it here. You can go to the laboratory outside to get the test. Sometimes when they finish, diagnose you, they don't give you the medications. They write the medications and ask you to go to the pharmacy. They tell you, we don't have this particular medicine, but they treat the disease you went to the doctor for is covered in the health insurance minimum package you're talking about. Even things as low as common as malaria and typhoid medications, hospitals also send people to pharmacies to buy them. And then people go to pharmacies and pay money for them, whereas they should have received those medications for free, or at least at a subsidized rate in the hospitals, haven't paid their premium already to either the NHIA or to other private HMOs. What do you have to say about this? Are you guys regulating this? What are you guys doing about some of these things?
Okay, thank you very much. In fact, we have, I think, these questions are very, very important because these are some of the things that people take for granted. People approach their hospital, the hospital they chose, and then at the end of the day, the hospital undermines, or rather, does not measure up to what the quality of care that is stipulated for them to, and people just walk away. Many people do not come in to lodge these complaints. That's the problem. And many people feel that, what can they do? Anyway, since they have been able to at least they have achieved some consultations with some professionals, that if it is just the drugs, that's still shortchanging. That is still some major moral hazard on the part of some of these providers, or hospitals, as you call them, but we call them healthcare providers. Now, had it been they came in and lodged a complaint, we have had to get some hospitals to either get some drugs or refund some money. But when they walk away, there isn't much we can do about it because there is no way we will know. And then in the pursuit to restore some level of trust, NHIA has even gone a little bit further. And in some of these major hospitals that we have significant numbers of lives, we have some desk officers positioned there so that they can monitor what happens and then immediately install redress when it is necessary. But what we still see is that some people immediately they are denied in some of those areas. They just walk away and tell you that in fact, some of them have a way of throwing it back to God, that God will see them. And then we also have this area of the
I think you're having a network issue.
As we call them, also is to change from hospital to another. And they can vote with their legs. That's exactly what we call it. They can approach our office and change from one hospital to another. And even there is a new self-serve portal that we have that people can, even in the comfort of their own place, as long as they're subscribers, enter their own portal and change from one hospital to another. And in a couple of months.
Oh, you're breaking. Dr. Chimeze, you're breaking.
Hello?
Yeah, your network keeps breaking.
Okay, apologies. So that's exactly what we and then we also conduct what we call quality assurance exercises. Hello, please, are you still hearing me?
Yes, I'm hearing you. Go ahead.
Okay. We still conduct what we call quality assurance exercises. These are impromptu exercises that we use to visit hospitals, pull up patients' folders, and see the management plan, whether it is in consonance with the diagnosis. But you know that sometimes they will write the management plan and write that these drugs were dispensed. So the only way we will know whether we are actually dispensed is when the enrollee or the patient approaches NHIA with a complaint and then an evidence to buttress their position. So as for seeking redress, it is all part of the deal. And whether we normally insist on the right, in fact, in our program, the enrollee is the king. And we have installed lots of toolkits to ensure that they secure their redress whenever they are shortchanged.
Okay, thank you so much, Dr. Chimeze. Yeah, the enrollee is the king. That's what it's supposed to be. But we have to bring in Doris, who is a health insurance agent in Owerri, and she enrolls people in health insurance. And she has over 100 clients at Sea Health that she enrolled in. And we want to hear from her the experiences of these enrollees as they try to access health insurance, whether from NHIA or whether it is from HMOs affiliated with NHIA or from private sector health insurance actors because she enrolls people both into NHIA, into DOT, into all kinds of health insurance. So, Doris, could you share your experience? What are you hearing from people? What challenges are they facing? I mean, if there are positive stories, by all means, please tell us. What are you hearing from people? What challenges are they facing as they try to assess care? And we're not talking about things that are their fault, so they don't do what they're supposed to do, but through experiences they face in the hospitals or trying to assess care with their health insurance products. What are you hearing from your clients?
Okay, thank you very much for this privilege. Okay, being the program officer under the Sea Health Department, I have a lot of clients who, of course, I register for health insurance, and I made it as a duty on the monthly basis to call each of these clients who want to know if they are assessing their health insurance the way they should, what are the complaints from the hospitals they have registered, and all of that. And to be very honest, let's say I get more like out of 100, I get like 50% positive response, right, from most of these my clients, which of course they have given me their review and feedback on how they get seamless um, medical attention from those medical facilities. While there are still some who complain about being unattended to, like they just come in, they just look at their card, they said, "Oh, please just hold on," and they keep keeping them there. And at the end of the day, they just tell them they can't attend to them. Okay, and I've also had complaints of clients in terms of dispensing drugs. There are some coverage that they are entitled to get from the health insurance package they have subscribed to, and they don't get to leverage on those privileges. They get to ask them to go to other laboratories to make payments and run those tests, and of course get medications, which I think is something that is disturbing. And as a health insurance program officer who already registered these people, I also take back this feedback to the agents, which I'm working with, and of course we try to see a way to solve these problems for them.
Okay. So,
Can I answer to that? Can I speak to that?
you can speak to that.
Okay, thank you very much. And Madam Doris, good afternoon. Well done. Thank you very much for at least introducing some of these people to health insurance. But I have never seen where you came in and lodged any of these complaints. One. Two is that some of these plans that you talked about, we don't know whether some of them are on the private and in the private plan area, I guess. Please, subsequently, let's get these complaints and then get to know which of, because it is when we investigate that we find out who is really at fault. It may be from, just like she said, that they asked them to wait. It is possible that they were trying to secure authorization code from the HMO that is purchasing for them. And I wouldn't know, because some of these plans, we will need to investigate them and ensure that they are in conformity with the basic minimum package of healthcare that I mentioned earlier on, since some of them are in the private area or in the private sector. Because most of the times we have seen situations where some of the stakeholders who go out and sell things that they cannot even provide, and then start looking for ways to cut corners. Please, subsequently, let's get the specifics. The name of the patient, the portal of entry, the type of program, the HMO involved, the hospital that they have gone to secure source for their healthcare management arrangement, so that we'll look at all the cards and see who is at fault. Because I cannot stay here and base it on just your say-so and then start telling you that it is the fault of the hospital, or it is the fault of the patient, or the fault of the HMO, till we know the specifics. And then we have pulled the patient's folders and even interviewed yourself. Because the other day, one man came to my office and was like, my wife paid, and she, up till now, you are saying that her name is not reflected in your register. I was like, okay, sorry, can we get madam? Because we have gone through our register, we didn't see the woman's name. Please, can you give us madam's phone number? Okay, let me call her immediately. Call the woman. A couple of minutes later, he stepped out of our office and was still talking to the woman. Also, I understood. Before I knew it, the man was across the road. I was like calling him, come back. Let's tidy up what you did. He said that I should forget it for now. Let him finish his own investigation. This is someone that has already come to our office to lodge a complaint. It all happened that, it was later that I called him on phone. It all happened that he gave the wife money to come and subscribe for health insurance. And the woman ate the money and did not even come here. So okay, there are lots of possibilities.
Yeah,
what we will want subsequently, let's have the numbers, let's have the names and specifics, so that it will enable us find out who is at fault, and then the necessary measures will now be installed.
Okay, thank you, Dr. Chimeze. And we appreciate the efforts you're making. I know one of the problems we have in Nigeria is reporting, because for too long, reports were not taken seriously, and people just don't see any reason to do that anymore. But from what you're saying, the dynamics, the space is changing, and your team, you and your colleagues are working so hard and resolving issues brought to you. So we are also telling our viewers from across the world.
We have had to deaccredit some hospitals. Yeah. We have had to deaccredit some hospitals that are not measuring up to our specifications. And then some HMOs have also been deaccredited. Yes. So health insurance is very, very closely being regulated by NHI. And the new administration in place is after quality, because we are working very assiduously to restore the trust people should have in the program. And then so that we can drop this out-of-pocket payment and pursue universal health coverage very closely. Okay. Sorry to interrupt you.
No problem.
I just needed to bring this as well.
Thank you so much. And it is very interesting. It's a very, it's an eye-opener, for so many of us, or many people out there who think that there's no need to report, there's no need to complain. Now, we all know that if we complain, our complaints will be handled. At least in Imo State, where Dr. Chimeze is working, we don't know what may be happening and all that, but I would imagine that his colleagues all over the country are also as active and passionate as he is. But Dr. Chimeze, let's talk about your specific health insurance product, the public one. Let's call it the public health insurance product, which is the NHIA health insurance. How effective is the health insurance? How is it working? How has it been received? What challenges people are facing? And Doris is standing by the corner here because she has signed up people for NHIA, and she gets complaints too. She gets commendations too. So once we finish saying your own, we'll also go back to the
You will
person
stay
here
at home.
from the hottest
I understand.
from the hottest mouth because you are for the you are for the government. So I'm sure you will be
Okay.
honest, but you will also you will also pat yourself on the back anyway. So tell us about your product.
Okay, thank you very much. In our pursuit for the universal health coverage, NHIA on our own part, apart from the basic minimum package of healthcare that I told you about, have also gone ahead to design different products for different strata of the federal government, of the populace, the Nigerian population. And just like you said, all these quality measurement and assessment tools that we are deploying is being deployed right across the country. It is not just in Imo State alone. We are making sure that everywhere in this country that health insurance is receiving adequate regulation so that people are not shortchanged. And there is need, just like I said before, there is need to restore trust so that people know that, hey, when you effect payments, you get quality for what you've done, or you get quality for what you've paid for. Then you're talking about visibility and reception. The truth about the matter is that we are really thriving. We are doing exceptionally well. And the support that we are also giving to the state-owned health insurance agencies have also propelled us into some areas that we couldn't just walk into before now, like the state civil service area. That area, we left it for them. And then some of the state-owned tertiary institutions that are also overseeing those ones. Then let's talk about the federal setups. We have programs for different strata of the population. We have the formal sector program, which was just like my Director General said, is the low-hanging fruit. At least those ones in that area, it is easy because they receive salaries, and therefore payment arrangements or their premium payment or their premium payment is easier because the employer is the federal government and they are the employees. Payment can easily be done. Then we have programs for the informal area, for the informal sector area. We have two types of programs. We have the programs where, for those ones that are paying, and then we have some equity programs where money is not being collected from anybody, but the federal government in itself is taking care of some of those fields. Let me talk about the one where we organize them to effect payment.
Okay. So, Dr. Chimezie, sorry to cut you off here, but let's just give our people what they want to hear. How much is NHIA? If somebody is paying out of pocket, how much is it for how much is the premium for the year? And
that I was about to talk about that area. We call that program the program that we designed for the informal sector and maybe some of the communities that do not have that are not working directly with the federal government. We call that program GiftShip. It's a product that we designed, and we have 4 subsets of that GiftShip. We have GiftShip N, we have GiftShip R, we have GiftShip C, and we have GiftShip G. Now, GiftShip G is the one that is designed for the man on the street, the suya seller, the keke driver, the taxi driver, the motorcyclists, those people that are selling car parts. So anybody that do not have up to 5 persons in their employ is deemed the informal person. And we have a very high population in that area. So what we did is that, it is still social health insurance, and therefore subscription for this is not, our portal for subscription does not admit only one person, since it is supposed to be done in a group. So that GIFSHIP is an acronym for Group, Individual, and Family Social Health Insurance Program. Group, Individual, and Family Social Health Insurance Program. The program is supposed to be 38,710 naira per person, but the portal does not admit one person, at least 2 people simultaneously. And if you add a little bit of the remitter charges and some other things that they are supposed to pay for, it comes very close to 39,000. So if it is for 2 people, it should be around that kind, 78,000 naira. Now, even at that, there is still a rebate. That's when the person pays with, what is it called? The ATM. There's still a rebate, a little rebate that the program returns to the payer. And the person with this program has access to the entire healthcare benefits that is accruable to federal government employees. Under this program that the person did not even pay up to 39,000, the person is entitled to surgeries, but there are terms and conditions that are applicable. And then that's after waiting for 2 to 3 months, the person's name will now be reflected in the system. And then the person in the first 6 months is entitled to some primary procedures. Then after the first 6 months, the person has the entire healthcare arsenal in the nation at the person's beck and call, because the individual can be referred like from Imo to even National Hospital in Abuja, and the person has access to even benefits that, a very good example is our cancer. We have a cancer program. The person has access to even that as well, where some of the molecules that are used for managing their condition is quite expensive. There is a molecule of 2.8 million that is also included in this program. So talking about that some enrollees do not have access to drugs that are not even up to, that's exactly why if they come in and lodge their complaints, we follow it up. Even the highest tertiary healthcare facility in Imo, the FTH, has recently insisted that every NHIA enrollee must get all their drugs in their hospital.
Okay.
It's a new development. They have a circular to that effect. And I presented it at our last peer group review.
Okay, share that circular. Can you share that circular with us so that we can also share it with our public, so people can know that you guys are doing a great job out there in terms of.
I'll send it to you after the program. Okay. I have it scanned. It is inside this phone that I'm using to talk to you.
Okay, thank you so much. So, Dr. Chimeze, you have really explained how the product works, but there's an area I want you to talk about a little bit. I want to talk about companies and businesses that have more than 5 employees. I understand that they are required by law to provide health insurance, or at least to offer health insurance to their workers. Because I'm talking about this because this would go a long way in cutting down the number of people who don't have health insurance. I mean, it's more shop in Alaba International Market, probably has like about 5 people, 5 house boys, 5 girls selling for them and all that. Now, does the law require such small businesses to offer health insurance? And is your agency also enforcing this?
Okay, thank you very much. First of all, I want to really commend CSAAE. In fact, anyway, just like I told you in that peer group review, I told them that one of my strategies is that I'm trying to partner with CSAAE, and that Father Abowa has really brought in some state-of-art equipment to ensure mass mobilization. I've already mentioned it at the right place. So thank you very much, Father, for the enormous work that you have put in. And anyway, I know that very soon it will start yielding. Now, touching the area that you're talking about, the Act stipulates that every Nigerian, not just companies. Now, so it is even insistent that the companies are expected to have done this long before now. But we are also going ahead to do, we are putting measures in place to insist that those people that have not complied are going to start having some difficulties very shortly. Now, very soon, before you can get your some of these like driving licenses, your international or traveling documents, you must have health insurance. So very soon, all these things will be, even if you want to transact any business with the government, we're also working in that area.
But my question is that what is the duty of companies and organizations? Why do they come in with regard to providing or offering health insurance to their
employees?
In the Western world here, I would say 80% of people get health insurance from work. Is that the same? Does the Nigerian law, Health Insurance Act, mandate companies or businesses to offer or provide health insurance? And how does that work? Is it contributory? Is it you pay for them, or what? Do you have such information? I mean, if you don't have all that information, we can come back again next time and talk about it. But it's a very important thing for us because we are trying to enforce that in the state, because we believe that if companies and organizations, no matter how small, if they provide health insurance for their employees, it will cut down the number of individuals trying to pay out of pocket, pay individual insurance.
Okay.
Talk to me about what you guys are doing about.
Thank you very much. I cannot speak to the companies that are in Lagos, but the fact is this. We have intensified advocacy quite all right. The determination as to what percentage is supposed to be paid by a company or by the employee is strictly on the individual companies themselves, because there are some companies that have already undertaken decided that they are paying for all their employees. Some of these big conglomerates pay for their employees. Some of them will pay the stipulated payment and then collect the other ones from the employee's salary. So that aspect is on individual company basis.
What is the stipulated
payment? We do not insist that, but for those ones that choose to do part payment, the percentage from the company is supposed to be 3.5% of the consolidated. It is also based on the assumption that all of them are paying the minimum package of salary, which is 70,000 right now. Mm-hmm. But if they are not, we also have a flat rate.
What is the flat rate?
It takes us back to the gift ship. because that's what is actually determined.
Okay, so let's get this straight. Let's get this straight. First and foremost, the National Health Insurance Agency requires, National Health Insurance Authority requires businesses in Nigeria to provide some level of.
It's mandatory. It's mandatory, not just a requirement.
Okay.
It's mandatory for all the businesses to provide health insurance for their employees.
Okay, good.
In fact, we have even started from the hospitals. Every hospital that
wait a minute,
Dr.
Chimeze, wait a minute. Let's go step by step so that our viewers will not get confused. So it's by law. Now, if I have a company and I have only one employee, am I required to provide?
It is not mandatory for you to provide, but it is mandatory for your employee to have health insurance. Okay, and so therefore, whichever way it works, either he or she is supposed to either purchase for herself, but it is also in your interest to purchase for her or him.
Let's get the case. You can't force me to force my employee to have health insurance. You can't force me to do that. I want to know what the law forces me to do. What does the law force me to do as a business owner? If I have 2-3 employees, one employee, the law forced me to offer some level of health insurance, even if it is not 100%, even if it's okay, you are my staff, I'm going to give you 50% of whatever health insurance product you want to buy, or an HIA you must buy from that one, or so I want to know, because people want to know what the requirement is, and many people, if they like, some companies, like you said, charitable people can pay for their employees, it's okay. But some people can tell you, I'm going to do what the law has required. So does the law, because I have had people say that it's not every company that is required, every business that is required, that you must have at least 5 employees for you to provide some level of health insurance to those employees. But if you have less than 5 employees, then you're not required. I mean, you can encourage your employee to get health insurance, but you're not the police. We're not working at NHIA. We can't police individuals to go get insurance. The NHIA will have to find other ways to get those 2 or 3 employees working in my office to get insurance, whether by their driver's license or by their passport or by whatever. And I just want to know what I'm required to do. I have an organization. I have an organization, and I want to know what the law requires me to do when it comes to health insurance and my staff. I'm saying what the law. I'm not talking about what the church or grace or charity or whatever. Just tell me what the law requires me to do.
Okay. Immediately you have up to 5 employees.
Okay.
The law requires that you and your employees must subscribe, and that's on the company, because there is a significant part of the contribution that is expected from the company.
Okay.
And then the rest from the employee. And then, just like you said, that charity may push you to pay everything for those ones. That's when you have up to 5 employees. But if you have below 5 employees, your business is still deemed an informal business. But it does not exclude. The law insists that all the people that are working for you must have health insurance, but it is not incumbent on you to provide it.
Okay.
But where we will also frown is when, anyway, that one is not on us. And that's exactly why we cannot regulate their payment. But the law insists that every Nigerian, that includes the people that are working for you, must have a form of health insurance or another.
Okay, thank you. So we can encourage them to have that. But I'm also very interested in, because we are taking up advocacy on this, but we need to have the clear information, what the law says. Now, I have 5+ employees, and the law said yes, I must provide a certain amount of money towards my employees' health insurance. I know
Exactly.
why the law says that, because I can take the employee's part from his salary, his or her salary, and then pay it, and which is very good, because even if you give the employee his own part of the money, he might not pay for it. So I can say, okay, this is my own part. Government wants me to pay out of this 39,000. Government wants me to pay 10,000 for you, and then you are going to pay 29,000 for yourself. I am going to collect this 29,000 from the source, from your salary, and then add my own 10,000 naira to your own and register you in health insurance. That is the way it works. Even here in America, people will not, if you give people the money, they will not pay for it. So the employers take it from the source. You see, you have already told us the story of a woman that the husband gave money, she didn't pay. So human beings are crazy, but that is why the laws are there. So if I understand how much that a business should pay for his employee, and so long as you have 5+, more than 5 employees, it will help us in our advocacy, because we are really serious about this. We are really taking it up as a challenge in our office to crack down on businesses. Because in Imo State alone, if all the businesses insure their employees, we will have probably less than 500,000 Imo lives who do not have health insurance. You hardly find people who are not doing something for somebody. You know what I mean? So and it's not too much money. The thing is that these people who own this business don't even know what they are required to do these things. They don't even know they are required to do these things. Yeah.
Father, can I just take like 2 minutes?
Okay.
I'll be right back.
Okay.
Just 2 minutes, please.
Okay. Doris, are you there with me? Doris, are you there?
I'm here, sir.
Yeah, you went offline a little bit. So tell us, while we wait for Dr. Chimezie to come, tell us a little bit about the health insurance products you are providing to the public at C Health, and how people can reach out to you for their health insurance. What are the services you offer to them when it comes to health insurance at C Health? And what other kinds of health insurance products do you offer at C Health?
Thank you very much, sir. Okay, at C Health, we offer different packages of health insurance, both for individuals, organizations, and of course, families, right? So, those are part of the things that we do at C Health. We also train individuals on caregiver. We also render caregiving services as
No,
well
no,
as
talk to us more about health insurance. What other services about providing service? Do you support individuals to access care? When people report
yes,
to
of
you
course.
about the care that they don't access, what do you do about it? What array of services do you provide to individuals when it comes to accessing health insurance?
Okay, we actually follow up every individual who have registered under our organization to make sure that they get proper health care at every point in time. We, for those who may have issues with hospitals, we have to reach out to those hospitals to know what the problem, what challenges they are having, and why, of course, they are unattended to. And we also, as much as possible, we reach out to our agents. We work most of the HMOs that we work with to ensure that whatever complaint that this client must have brought to us is being looked into actually. So
Okay, thank you so much, and welcome back, Dr. Chimezie.
Thank you very much.
So we ask you just answer the last lap of the question, and then we'll wrap up.
Okay.
How much complaints are required to contribute? I mean, you mentioned it before. You say it's 3.5%.
Yeah. I wanted to. Okay, sorry.
Okay.
I wanted to say that when you were citing your, I think you were just trying to illustrate quite all right, but then you said
you bring 10,000, and then the enrollee or your worker brings 29,000. It is supposed to be the other way around, though. You are supposed, because it is in your interest that your worker is healthy, so that they can deliver on all the KPIs or there's indicators that will make your company successful. So you're expected to pay more and then take less from the employer. So if you have more than 5 employees, it is expected that you must have secured health insurance for all of them. And if you insist that they are expected to pay, then they pay just like 1.5%. Because the whole thing comes out to 5%. It used to be 1.75 from the employee, and then 3.5 from the employer. But I think after actuarial determination, they decided that, okay, let the thing come to 5%, 3.5 from the employer, then 1.5 from the employee. So if you have up to 5,
what is 5% of what?
The take home, the consolidated salary.
Okay, so the take home salary.
That's if
the insurance.
Yes, let's say that right? You pay them 100,000.
I know what
you're fine.
I know what you're talking about. The take home.
Okay.
I know that when you go to pay slip, you have health insurance, you have.
Thank you. Exactly. It will be reflected.
You have housing.
It will be reflected in your pay advice. Exactly.
So the entire take home of the person, the 5% should go to health insurance. That's what you're saying.
Exactly.
Now, out of that 5%.
But inside it, 3.5 is coming from the employer, not from that take home. Then it is just like 1.5 that you take from that salary and then add it to your 3.5 and effect the payment to NHIE. But before you do that,
usually
there are some preliminary stages. Sorry, please. Before you start remitting the payment, there are some preliminary stages of that process where it's expected that you furnish us with your nominal role. The nominal role includes the number of people that are working for you, their different cadre, and their payments. That's their payment arrangement, how much they get, so that we can actually determine whether it meets our specifications. If it doesn't, then we can decide and make it a blanket payment that you are expected to make.
Okay, so let me see if I understood you very clearly. And I'm very interested in what the law has said. I mean, we can always, I'm a priest, so we do a lot of charity too, but I first of all make you do what the law has said. You have said that if you have more than 5 employees or more, you are required to contribute to the health insurance of the premium of those employees. Now,
exactly,
for you to, number one, you are supposed to contribute 3.5% of 5% of the basic salary of the employee. That's what we call it. The basic salary is the one that is not taxable.
No, not the basic, the take home. Because if you do the basic, most of the time,
the take home is whatever he goes home after taxes. That is what is take home. That's what it is after taxes.
You know, that's before taxing. The take home before taxing.
Before taxing is gross now. Is gross. So you're taxing the head.
Actually, we call it consolidated.
Okay. We call it gross in the work sector. You know, we call it gross and net. Gross and net is if your salary is 200,000 naira a month, and then we pay government taxes 20,000. So your gross is 200,000, your net is 180,000. That's how we calculate.
No, it's 200,000 that. Yeah, the percentage is on the 200,000.
Okay, the percentage is on 200. Okay, no problem. Good. So it's 5% of the 200,000 goes to health insurance. That would be a lot more. You know, it will be more than that.
Because the package is, and if you look at it very well, okay, now let me even expand that just a little bit. If we look at that's exactly why we would normally demand for the nominal role. The nominal role will tell us whether they have wives and children that are below the age of 18. You understand? And if it is high enough, we extend the cover to them, not just on the individual, the index person that is working for you.
Okay, so Dr. Chimeze, listen to, we're going to end this program, but you are going into a very interesting area. And I want to work on this area with you. We can actually convoke a workshop, bringing employers in a way together to work this out and to explain. Because here in the United States, my accounts officer works it out. They don't need to go to your office because they have been educated on what to do. You can't get every employer in Imo State cannot bring their nominal role to you and everything, but you can educate every employer in Imo State on what to do. And our office is willing to organize that formal forum where we can bring the employers, at least in Imo State, in your own case where you're working, bring them. Look at all these hotels we have in Imo State, plenty of hotels everywhere.
And schools.
Yes, and schools. So we can bring them together and you can explain the legal requirement with them so they understand it. So that some of them who are even paying this insurance will not think that they're doing a favor to the employees, or when in fact they are doing what the law requires. And some who are not paying it will understand. And their accountants or their account officers can actually work this thing out, making it easy for your agency. Otherwise, if you ask us to be coming to you, everybody will be coming there. Because as we promote this thing, I don't want to start telling everybody go to NIHS. Everybody will just be going there because we're going to take it very seriously. So, but we can't finish this in this conversation. And I'm assuring you that this is a conversation I want to have with you and your authority for many, many weeks and months to come. And I'm looking at a situation where we have to bring as many as possible employers in Imo State together under one roof and explain this to them. Because it is not like some of them don't want to give insurance, but some of them don't even understand it. Knowledge is the greatest part. You might think that, we have over over 6 million people in Imo State. So
many of them and many of them are quite educated.
Yes, so when we don't...
A very significant number is educated.
Yes, but I run into a lot of people and I tell you that people who don't know about these things are more than those who know about them. And awareness is very key and critical. At least by the time we do 3 or 4 sessions of this engagement with employers, you will begin to see differences. Because I believe that if employers, cover their employees, you will be dealing with, in Imo State, maybe 1 million people that have that are just maybe working in the farm, on their farm, or one man vulcanizer, or one man tailor, or something like that. Because just go to Alaba International, just a trader there, one trader has over 5 boys. Those 5 boys are their employees, and he's supposed to provide insurance for them. So, and I know your money is not too much, even if they're providing 100%. Even if they're providing 100% for 39,000, it's still not a lot. But I'm telling you that these guys at Alaba International Market with 6, 7 boys, they do not know this thing you're talking about. That is the reason. They are settling their boys with 10 million at the end of learning work. Is it 39,000 times 5 that they will not pay? They're doing all these things, but they don't know. I'm not. Some people may say, "Oh, I'm not." We deal with people every day. We meet with people every day, and I'm telling you that the greatest challenge you guys are facing is awareness, is education, is knowledge, and we're going to face this headlong in Imo State by fire, by force, and you will see what the result will look like. This is the way. This is the way Western has done it. My company here provides health insurance for me. My company here provides. If they don't do it, the company will flag them. And that is how, so the few people that have no jobs, then they now go under government umbrella. Government will not
exactly. I've not even talked about that equity program. And something I want to bring out is the fact that our program is very robust, very comprehensive. Do you know that in the national health insurance, our own formal sector benefits package includes virtually everything, including both radiological investigations, laboratory investigations, and then different kinds of reconstructive surgeries. Can you imagine that we have a cancer program? We are running it with Roche Pharmaceuticals. That's this German pharmaceutical company, Roche. They bring in lots of very high quality molecules that they use to manage cancer. And most of the times, the patient's outcome is far improved. That's even after the first cycle of care. Check out rituximab, one of the molecules that they bring in. Rituximab is in the normal market is 1.8 million. I'm telling you, we have a very robust cancer program, and the federal government was magnanimous enough to in the southeast. There are 2 tertiary healthcare facilities that they are running the program with: UNTH Enugu and FTH here in Owerri. So people coming from Anambra, from Abia, to use that program, because there is a very significant high prevalence in some of these cancers, especially the ones that relate to women, breast and cervical.
Okay.
So
thank you, Dr. Chimezie. I think we're running out of time. Like I said, this is not something we're going to finish in one conversation. It's a very interesting one, and we're going to do more about this. But thank you so much for all the information you have given to us today, for the work you and your team you are doing out there in Owerri, and the work that NHIA is doing all over the world. We know that the health insurance is working in Nigeria. It may not be perfect, but at least it's working. I know I tell my siblings, I say, well, even if we don't get the medication, but at least you can see a doctor for free, which is like about 10 to 20,000 naira. But we don't want to settle for that. We don't want to settle for that. But at least we're saying that people should understand. Nigerians need to know that national health insurance is working, and other insurance products in Nigeria, they are also working. We have to find a way to talk our people out of that mentality that these things are not working, because this thing would help. This thing is causing problem. You're sick, you start calling your uncle for 500,000 and he doesn't give you say he's wicked. Why would you? That your uncle could have also paid 39,000 for you at the beginning of the year, and you don't have to call him.
Yes, in the course of the year.
So that is why our organization is taking it very seriously, because we are very, very concerned. We're interested in healthcare, which we consider a human right, fundamental. And we are going to do all we can with your agency to take the word out there, if not in Owerri, but at least in the southeast and across Nigeria. So thank you, Dr. Chimezie. I'll ask you to use 1 second to say one final word to your viewers from across the world. And Doris, I will also ask you to say your final word to your viewers from across the world. Thank you.
Thank you very much. Father Abawa, I really appreciate and commend CSAAE for this beautiful initiative of hosting some of these webinars and then bringing people to the knowledge of all these products. And please, do not hesitate to bring in any form of complaint or concern from the people that are subscribing through you. Just be rest assured that NHIA is regulating all the sectors and all the players in the field. We can suspend DOT if we want, just like you mentioned. So let them also know that whenever there is an infringement, that you're also bringing it to NHIA, because we can summon whoever processed their registration. Then I'll also want to throw it out there that the federal government has also done exceptionally well for the indigents and the vulnerable sector of or strata of the populace. We have programs that are designed for them that they do not pay 1 naira for. You must have heard of Basic Healthcare Provision Fund.
Yeah. Okay. Thank you so much.
And then the other ones, Thank you very much. Thank you for having me.
Thank you, sir.
And
Yeah.
please do not hesitate. Anytime I'm ready to talk to the people about it. I want to use this opportunity to beg them. Please come and subscribe. It is the cheapest way. People normally think that it's not my portion. It's not my portion. I wonder whose portion it is.
Opportunity, the communication team is on me. They say our time is up, so I know.
Thank you.
Don't worry, we'll bring
Thank
you
you
back
very much.
again.
Have a wonderful, wonderful afternoon, sir. Thank you.
Thank you. Doris, do you have a final word to your clients and customers and people watching you from all over the world?
Yes, I'm just going to be very brief, and I'm going to use myself now. I'm not talking about the clients. I am, in as much as I register people for health insurance, I'm also an enrollee for health insurance. And for those having the mentality that health insurance does not work in Nigeria or is not effective here in Nigeria, it is effective because I am one of the people that enjoy those privileges. So the earlier we get that mindset or thought out of our mind and start getting it the right way by enrolling and having your health insurance, the better for all of us. Thank you.
So when people want to enroll health insurance through you, how do they reach you, Doris?
Okay, they can reach us via our number, which is 0704 600 7185. I'll repeat, 0704 600 7185. Or they can come to our head office at number 17 at Joko Street, behind UBA Bank, Wedra Road, Owerri. Or they can also reach us via our CHealth website at chealth.csaaeinc.org. Thank you very much.
Okay, thank you, everybody. It's been a very great moment, and we shall continue this conversation. This is not the last word. We shall continue this conversation. But in the meantime, go and get your health insurance. Doris and her team are not just only enrolling you, they are following up. If you have any complaint, go to Doris. She will call Dr. Chimezie right away, and she has access to the coordinator of health insurance in Imo State. So you are in good hands. Whatever you tell her, she's going to tell the National Health, Dr. Chimezie. And I've known Dr. Chimezie, he's very passionate. Any comment reaching to him. So let's not stay home and say, oh, it's not working, oh, it's fraud, oh, it's government, just do your own part. Just try. Just try. Go to the hospital and whatever they tell you there, come back. That is why we're staying in between and trying to make this work. Our advocacy department, we are, working hard to ensure that we benefit from it, especially those of us from the East. We tend to just not take government benefits very seriously, when in fact that they are working. What's the point, wasting money elsewhere when you can get your NHIA? I mean, 39,000, even if you enroll your entire family of 5, it just doesn't break the bank for you, and you can get a cancer treatment of 1.5 million. So, reach out to Doris or go to her office at 17 at Joko Street. Let her enroll you, and she can make things easy for you. I mean, the hassles of taking pictures, and all that stuff, they remove all that from you. And plus, the fact that she is always in touch with the coordinator of the National Health Insurance in Imo State makes it much easier. At least that is a direct access to the person. And she can also pass you over to him if need be, so he can also look at your case very closely. So thank you, Dr. Chimezie. Thank you, Doris. And thanks for all the great job you guys are doing for our people out there in Nigeria and Imo State. Let's meet on this issue sometime soon. God bless you all. Bye.
Thank you, sir.